I'm Eric Moadamian. I am Associate Professor in Orthopedic Surgery, and I am the Director of Orthopedic Trauma here. I'm from Elizabethtown, Kentucky originally. I went to undergrad here in Lexington, Kentucky at Transylvania University. Spent my medical school here as well in Lexington at the University of Kentucky, and came back home. My specialty is orthopedic trauma. We tend to see patients that, I call it putting Humpty Dumpty back together again. When patients have kind of their worst day, they fall off a roof, they're involved in a motor vehicle collision, a motorcycle accident, or sporting activity where they just break a simple bone. My job is to kind of put those folks back together, try to restore them back to the normal function that they had prior to that accident. My team here at UK consists of a small group surrounded by a larger group. So I am one of 4 orthopedic trauma surgeons, and then we of course have a PA who assists us in the clinic and the operating room, and then we have a team of residents who are our surgical trainees. They're physicians that have gone through medical school and they're in their training stage to become an orthopedic surgeon. And of course we're also surrounded with the trauma and acute care services, which consists of the nursing staff, the general trauma surgeons, the neurosurgeons, and the other surgeons involved in the trauma patient's care. Most of our patients come through the emergency department. They're usually trauma activations, so patients that have had a very severe injury, but a lot of our patients are the patients we take care of that have a routine. They have a fall, a slip, just have a simple fracture as well. So we take care of the most complex fractures and injuries to the more simple routine fractures as well. A lot of my patients, we see them kind of at their worst, or at least on their worst day. You know, as opposed to most orthopedic surgeons where you take care of patients with chronic painful injuries and then you quickly with a procedure or surgery restore them back to much better state of health. Most of our patients are fairly normal functioning and very healthy individuals and a week, a day, or even hours before their accident, and then I get to see them at kind of their worst time in their life. These patients have bad injuries. And so we try to make them as perfect as we can. We know we can't make them and restore them to their previous state of health 100%. I can't do what God did, but I try to do the next best thing.